My background, like most pediatric rheumatologists, I trained as a pediatrician. I then became interested in pediatric rheumatic diseases, including systemic autoimmune diseases, autoinflammatory diseases, and bone metabolism. I participated in clinical trials and studies to better understand these diseases, improve their classification and diagnosis, and contribute to the development of clinical guidelines and recommendations. Currently, I am head of department at Hospital San Joan de Déu and director of the Pediatric Immune Dysfunction Diseases Study Group. Over the year, I have had a particular interest in educating and training young professionals, as well as colleagues already in practice who are interested in rheumatic and musculoskeletal diseases in children and adolescents. I am also currently a professor of pediatrics at the University of Barcelona. This position allows me to balance my career as a clinician and researcher with a focus on education. EULAR is the world's leading scientific society for rheumatic and musculoskeletal diseases. Its recommendations, points to consider, online and in-person courses, and research projects are widely recognized by the international rheumatology community, including health professionals and patients and their families. Thanks to the work of its advocacy committee and others, EULAR has also become a recognized voice among health policymakers. However, EULAR must maintain its focus on the most disadvantaged patients and the professionals, especially trainees and young professionals, who strive daily to improve patients' health. To this end, we must increase collaborative projects, expand educational activities, facilitate the exchange of research, and expand resources that can improve the lives of people with rheumatic and musculoskeletal diseases, especially children and adolescents. First, I would like to represent the perspective of pediatric rheumatology community into EULAR. I aim to incorporate the perspective of children with rheumatic diseases, their families, and the pediatric rheumatologists who treat them into all of EULAR's initiatives. This involves collaborating with pediatric representatives on EULAR's various content committees, including advocacy, research, quality of care, and education. Furthermore, I aim to establish connection and facilitate communication with other scientific societies, especially the Pediatric Rheumatology European Society, PRES. Collaborating for the benefit of all children with rheumatic and musculoskeletal diseases is a key objective for the coming years. This also involves enhancing collaboration with communities such as healthcare professionals, Immunet, and PARE. The first step toward developing and implementing solutions is jointly identifying and analyzing the unmet needs of pediatric patients with rheumatic and musculoskeletal diseases. One project I am particularly interested is in working on transition. Transition from a pediatric rheumatologist to an adult rheumatologist is more than just a change of physician. It is a complex and vulnerable period that can significantly impact long-term health. Therefore, we must update, disseminate, and implement recommendations for well-structured transition programs to adult services to ensure continuity and quality of care in all of our countries and health systems. Almost all pediatric rheumatic diseases are rare diseases. This means that the voices of patients and their families are sometimes not heard, nor are the voices of pediatric rheumatologists and health professionals who care for them. Collaborating with EULAR can amplify these voices and educate society, healthcare community, and policymakers that people with rheumatic and musculoskeletal diseases include children and adolescents. Furthermore, joining the EULAR PAED community offers access to a wide range of educational materials and research projects and facilitates networking with experienced professionals and experts in a professional worldwide environment.